We are joined today by physicians across Arizona in the wake of the primary election on Tuesday to discuss what the gubernatorial candidate Andy Biggs would mean for healthcare and their patients in the state if he were elected. Before we begin, I'd like to note that these physicians are speaking today as individuals and with us at the committee, not necessarily on behalf of any employers. So we respectfully ask that you only refer to them in any coverage as they introduce themselves, and please do not include any employment information unless they expressly share that. So thank you in advance for being respectful of that. Without further ado, I will introduce our first speaker, Dr. Harriet.
Good afternoon, and thank you for listening. I'm Dr. Danielle Allen Harriet. I am an OBGYN here in Arizona, serving patients in Maricopa County in the East Valley, as well as in Pinal County and Casa Grande. I care deeply about this issue, and I know that we have patients every day that are just trying to get by. I'm seeing how policies from both sides of our, state and national capital are going to make it harder, and then policies sometimes that'll make it easier for those people to access healthcare. And that's really why, as a physician, I am worried about what Representative Andy Biggs is going to mean for patients as a governor of Arizona. On Tuesday, Congressman Biggs won the Republican nomination for governor of our state. But my fellow physicians and I on this call are deeply concerned about his record and views on healthcare. It's incumbent upon us to share them. I feel particular responsibility because Andy Biggs is my current representative here in Chandler in Congress. And Rep. Biggs has supported devastating cuts to healthcare generally, which means my colleagues will talk more, which my colleagues are going to talk more about here in a moment. But this has affected my patients directly as I work in a federally qualified health center, and I see patients who rely deeply on these types of programs that are being cut. As an OBGYN, I also am invested on stances on reproductive health care, and his stances specifically worry me daily. So the conversations that I'm having every single day with my patients, they're built on trust, right? They're built on medical evidence. They're built on individual circumstances for each of the people standing in front of me. This is not a decision that any politician should be making. Unfortunately, Congressman Biggs has spent years trying to insert politics in some of these most personal moments of my patients' lives. He's consistently opposed abortion access and supported efforts to ban abortion nationwide. He's backed legislation that would undermine access to reproductive health care and has repeatedly supported efforts that will allow politicians, not physicians and my patients, to dictate medical decisions. We know that when politicians interfere with medical practice, that patients suffer. We saw this when the U.S. Supreme Court took away the federal right to abortion in 2022, and Arizona's various abortion bans went into effect, causing confusions and delays in care. While working on call in the hospital back at that time, I had ER physicians and patients asking if I could take care of their ectopic pregnancy, if I would come save their life or not because of those bans. I had the same questions when patients were managing miscarriages. That damage still persists today, as every time that I'm on call, I get questions on what I can and can't do as an OBGYN. I had a patient in my office at 22 weeks of gestation with a devastating diagnosis of anencephaly after her anatomy scan. That's where parts of the brain did not develop appropriately and there was not skull covering. And that patient had to suffer and carry that pregnancy through to term during that time because she couldn't get care here in her community and had no means of transportation. That's not something I want for my patients to have to endure. I'm grateful that the voters of our state passed Proposition 139 back in 2024 to protect the right of reproductive care into our Constitution. But we have to be vigilant against attempts from state leaders to chip away at that right. Reproductive health care cannot be separated from access to health care generally. As both a physician and one of Congressman Biggs' constituents, I want leaders who trust doctors to practice medicine and trust patients to care and make their own healthcare decisions. Arizona deserves a governor who believes that healthcare should be more accessible, more affordable, and guided by medical evidence, not by political ideology. And Congressman Biggs is not that candidate. So I'd like to next introduce Dr. Shapiro to speak further.
Hi, thank you for joining us. I have been a pediatrician in Tucson for over 40 years. I'm also a healthcare advocate because I know the importance of children and families having access to healthcare. Many of my patients' families rely on Medicaid to stay healthy, live, work, and learn. That's why the nomination of Representative Andy Biggs is so concerning to me. Just over a year ago, Representative Biggs voted for H.R. 1, legislation that slashes Medicaid to help finance massive tax breaks for billionaires and large corporations. Those cuts, which conveniently don't go into effect until after the election, will have real consequences in Arizona, and in fact are already having consequences. Families will lose coverage, families like the ones I see each and every day. Rural hospitals will face even greater financial strain and are at risk of closing. More patients will delay care until they're much sicker, and those costs won't just disappear. They'll show up in our emergency departments and throughout our healthcare system, because that would affect everyone. Andy Biggs also voted against extending the Enhanced Affordable Care Act premium tax credits. Those tax credits had helped hundreds of thousands of Arizonans afford health insurance, and they were set to expire at the end of last year. Biggs and his Republican colleagues in Congress chose not to renew them. That is already having an effect here in our emergency rooms and on our hospitals and neighborhood health centers. Now, Arizona families are facing dramatically higher premiums, forcing impossible choices between paying for health coverage and paying for groceries, rent, or childcare. Many are simply going without health insurance. As physicians, we see what happens when people have coverage and when they don't. Health insurance means cancer is caught earlier, diabetes is managed before complications develop. Children like the ones I see in my office every day get care for asthma, allowing them to be able to run and play safely with their friends. They get vaccines that keep them from getting preventable diseases. They get behavioral health screenings that help them get the support they need to learn and live full lives. This is the type of care that Representative Biggs has already ripped away from families. As physicians, we're deeply concerned about what an Andy Biggs governorship would mean next. Our patients deserve better. Arizona families deserve better. Now I'd like to introduce Dr. Singhal.
Hi, everybody. Thanks for having me. As an anesthesiologist, I spend my career helping patients safely get through some of the most vulnerable moments of their lives, whether someone is going under surgery, delivering a baby, or needing an urgent procedure. My job is to make sure that they're monitored closely, kept safe, and able to receive the care that they need. But what happens before patients ever reach the operating room matters enormously. When people delay or lose healthcare coverage, they don't stop needing care. They avoid procedures, they skip follow-up visits, they put off treatment until their condition becomes much more serious, and then a manageable problem can turn into an emergency. A planned surgery can become a higher risk case, and hospitals absorb more uncompensated care, operating rooms face more pressure, and patients often arrive sicker than they should. That's why Andy Biggs' healthcare record concerns us and should concern every Arizonan as he campaigns to be our governor. As my colleagues mentioned, Representative Biggs voted for H.R. 1, which made the biggest cuts to Medicaid in the program's history. He also opposed extending the Enhanced Affordable Care Act premium, the tax credits which would help family purchase healthcare insurance. While these decisions are disappointing, they're not surprising, as his anti-healthcare record goes back years. In the Arizona Senate, Representative Biggs voted against the bipartisan legislation that expanded Medicaid under the Affordable Care Act. That expansion, also known as Access in our state, has provided healthcare to hundreds of thousands of Arizonans over the past decade. It strengthened hospitals, improved access to preventative care, and gave working families the security of knowing that they wouldn't go bankrupt if someone gets sick. Biggs, who was the president of the Arizona Senate at the time, said he would do everything in his power to prevent the law from getting a vote. Arizonans deserve leaders who do everything in their power to make sure people have healthcare and not prevent them from getting it. But Representative Biggs hasn't just opposed expanding healthcare, he's taken actions to take it away from people. In addition to slashing Medicaid, Biggs introduced legislation to completely repeal the Affordable Care Act. I'll be the first to admit that the Affordable Care Act is far from perfect, but repealing it and taking away healthcare for millions of Americans would only make things worse. Andy Biggs calls Medicaid a financial danger, but the real danger is the governor, Andy Biggs.
Thank you so much, Dr. Singhal, Dr. Shapiro, and Dr. Harriet. We'll now open it up for questions if you have a question for one or any of the physicians. There are a few ways you can go about asking that. You can use the chat function and type your question for everyone to read, or you can put it in the Q&A via Zoom, that function. Or if you prefer to ask your question verbally, you can raise your hand and I can unmute you or allow you to unmute to ask that question. So we'll allow a few moments for folks to be able to ask those questions. I had one chatted to me. I will share with you all to be able to see and read it. Rep. Biggs also voted for the largest cuts to SNAP in the program's history. How do these cuts impact your patient's health? And that's for any of you.
I can answer that because actually yesterday I was at the community food bank in Tucson, where they're putting an extraordinary number of food packages together for people because, as reported in the New York Times, 440,000 Arizonans have lost access to food stamps as a result of those SNAP changes. So that is another thing that absolutely affects patients' health. And we shouldn't have to rely on nonprofits to do something that should be the government responsibility to make sure people in the wealthiest country in the world, don't go hungry.
Yeah, I will piggyback back off of that. We see in our prenatal care all the time moms who are struggling to get access to good, nutritious food, and people who've lost SNAP benefits and lost their health insurance really struggle with normal weight gain in pregnancy, and that has detrimental effects downstream to the fetus as well. So we're seeing some of those increased growth restriction cases and things that are completely preventable.
And I think, especially in pediatrics, access to good nutrition is extremely important to overall health. And when you lose those safety nets and you lose the ability to know where your next meal is coming from, it can be a real struggle for families and for patients and really for the doctors who are trying to care for the most vulnerable people in the state.
Absolutely. Thank you all. I had another question chatted just to me, so I'll share it with you all. Rep. Biggs has referred to abortion as murder and slaughter. As doctors, how do you react to that characterization? And again, that's for any of you.
I'll take this one to lead. It's completely disheartening. You're minimizing a very complex situation, and he's utilizing very strong language to elicit an emotional response. But we need to take a step back and remember that these are real human beings walking into clinic with very complex situations and making very difficult decisions every single day of their life. And this decision to end a pregnancy comes so difficult to patients. I think the characterization is that people walk in and make that willy-nilly decision. And let me tell you, not a single patient who ever sat in front of me made that decision willy-nilly. There are always emotional and physical and financial and social implications and reasons for care. And so we should not be utilizing harsh language like this. We should be caring for the patient in front of us.
And let me just add that I think the vast majority of people in our state and in our country support what Dr. Harriet said, and they do support women's right to choose and make their own decisions with their physician and not with the interference of politicians. And as she had mentioned, we did pass the proposition that gave women the legal right to abortion in our state by a very significant majority.
And I think sometimes trying to turn an issue like abortion into something that's black or white is somewhat disingenuous because it involves more than just the fetus. It also involves the life of the mother. And without any hyperbole, there have been many women who have died because they have had lack of access to affordable care. They've had lack of access to reproductive interventions that would have saved their life. And so when it comes to the life and death of patients and the people that we care for, we're always looking out for the life of the mother. Not to say that the fetus is not important or that children are not important. We don't want to support them, but you always have to make sure that the mom is safe. And right now, by having these restrictions in place. We're having mothers and young women who are, otherwise healthy dying because they don't have access to care.
Absolutely. Thank you all. Thanks for that question. And then there's been one more question in the meantime. Rep. Biggs has co-sponsored the Life Begins at Conception Act, which critics say would threaten access to IVF. What would this mean for your patients if IVF access were more difficult to acquire?
Sure. Again, I'm going to ask that the politicians stay out of my exam rooms. I am the expert. The reproductive endocrinologists who see my infertility patients are the subject matter experts on in vitro fertilization. And those are resources in our community that are gold. We go to school for 4 years. We go to residency for 4 years. We may do a fellowship for 2 to 3 years, and then we see patients. We are the people who should make these decisions and help our patients decide what's best for them, not a politician. I don't know how much science that man has taken in his life, but I have taken more. And he does not get to make that decision or decide when conception begins.
Absolutely. I am not seeing any other questions. I will mention, in case anyone's typing another question, in the meantime, we've been recording this, so if you'd like a copy of the recording, you can let me know in the chat or the email where you RSVP'd. I'd be happy to get you a copy of the recording after we're done. But yeah, I'm not seeing any other questions, so I'll go ahead and wrap up today's call. Thank you, everyone, for attending during this busy week. And thank you so much to our physician advocates, Dr. Singhal, Dr. Harriet, and Dr. Shapiro. We appreciate your time and your advocacy on behalf of your patients and all Arizonans. So thank you all, and I hope you have a good rest of your afternoon.
Thanks for having us.
Thank you all.
Thank you for organizing.